Hello, everyone. I'm delighted to see you again. I'm Dr. Louis Fouché, anesthesiologist and intensivist, and specialized in ethics and anthropology of the health. And today I'm introducing the Independent Scientific Council session in English. So thank you to follow and try and read the subtitles, and you can switch on the subtitles when you want. And today we are delighted to host two international colleagues, Giovanni Trambusti. Hola, Giovanni.
Good morning, everyone, and thank you very much for having me here.
Good morning. Thank you very much. Can you introduce yourself, please, and tell to the French public who you are and what are your attributions?
Yes, I am an electronic engineer. I live in Florence, Italy, Florence. And my main occupation is data elaboration, data analysis and elaboration. So I joined the team with all the other scientists that collaborated to this study because I've done the first part of the work. So the raw analysis of the data coming from the source that we speak after in order to allow them to do the following sophisticated statistical analysis. This was my duty, and this is what I do usually in my professional work as an engineer.
Thank you very much, Giovanni. You live in one of the most beautiful cities of the world, and plus you have the talent to manage the data and enable us to not to fall into the different tricks and traps of mathematics. So thank you for that. And we also have one other writer of this study that you're going to introduce today, who is called Panagis Polykretis. Hi, Panagis. How are you doing?
Hello, good morning, Luis, and thank you for the introduction. I am a structural biologist, and I live in Florence too, like Giovanni. And let's say I did not have a statistical contribution on this work. I managed more the theoretical part of the consequences for health and the consequences of how this distorts the data on the effectiveness of the vaccine. And let's say it is important to mention that we have a very nice and strong group. The first author, Marco Alessandria, is a biostatistician, a researcher, and then there is Giovanni Trambusti, which is an engineer. There is Giovanni Maria Malatesta, that is a mathematician. Then there is me, and then there is our group leader, who is Dr. Alberto Donzelli, who is an MD. So we started making this study because we wanted to prove with real world data what it has been hypothesized in 2021 by Professor Martin Neal and Professor Norman Fenton, and which they called it the chip trick, basically. And this is a statistical trick that inflates the effectiveness of vaccination, while it decreases the adverse reactions of vaccines and transfers them in the unvaccinated group.
Okay, so I understand this is the main topic of your article is about the classification bias of vaccination and how it impacted the COVID-19 mortality and all-cause mortality, because people were classified vaccinated or not vaccinated, and you're going to try and explain us that. Do you have any conflict of interest with the industry, with pharmaceutical industry, vaccination industry? Do you have any money involved with the government or?
Absolutely not.
Okay, thank you.
No, absolutely not. We are both independent researchers, and we joined together because we found this common interest in discovering the truth through the analysis of data. We absolutely never work for this kind of industry.
Thank you very much. For the audience and the people who are listening to us, you can find the article reference at the bottom of your screen, and you have the sharp reference that you can get there to find back the article, and we will put that on the website as a joint file, an attached file. We have already also today the chance to receive Hélène Banoun. Hi, Hélène, how are you doing?
Hi, good. Well, thank you. I'm very happy. I'm very happy to receive Panagis, Polykretis, because I have been asked to review one of his article he wrote. It's not yet published. I hope it will be soon published. It's a very, very, very important article about the consequences of COVID vaccines in cancer. So it's very important with the mechanisms of this problem. I am a pharmacist and biologist. Former researchers are at INSERM, National Institute of Health, and without any conflict of interest.
Thank you very much, Hélène. And so you see today that we make the effort to speak in English. So we would like you to share with your English-speaking friend, and it's going to be translated just after. Okay, so now the speech is yours, Giovanni and Panagis. Do you want to share the presentation already, or do you need the presentation of Giovanni?
Yes, we can proceed with Giovanni presenting all the statistical work and the maths behind this paper.
Okay, let's go there.
Okay, so this is the first page of our study. So classification bias and impact of COVID-19 vaccination on all-cause mortality. The case of the Italian region Emilia-Romagna. In Italy, we had great difficulties in getting the data. No data was released voluntarily by the institutions, and it was released by some regions only after FOIA, so Freedom of Information Act requests. So explicit request of our collaborators, a lawyer, that decided to ask to all Italian regions the data about vaccinated people mortality. So I proceed. Okay, so what we got in Italy is this kind of definitions by the ISS, that is Istituto Superiore di Sanità, the Superior Institute of Sanity, of Health, Superior Institute of Health, that is the maximum authority for Italian health. And they defined what a vaccinated people is and what an unvaccinated people is. This is the Italian text, but I have the French and English translation. So these definitions were published on their official reports, published on the Italian state website, and they are very clear. Okay, so I will read the English text, but you can read the French one if you prefer. And they say, we assumed a 14 days delay between vaccination and the development of immunity in accordance with available evidence. Therefore, we defined unvaccinated. Okay, so I want to underline that here there is the definition of what is unvaccinated for them. Incompletely vaccinated and fully vaccinated individuals as those who had received the first, second, and third dose less than 14 days previously, respectively. So this is a little bit complex as definition, but if we read simply what is pertaining to the unvaccinated, we see that they define as unvaccinated person who has received the first dose less than 14 days previously. Okay, so to make it clearer, they have defined as unvaccinated who received the premier dose less than 14 days, and subsequently also the next doses had the same treatment. I mean that uncompletely vaccinated is who received the the second dose less than 14 days. Okay, and also this was also for the third dose. So this way, it's pretty clear that they put back all the adverse events, counting them to the previous category. Okay, so who is already vaccinated because he received the first dose, but less than 14 days, in the next 14 days, every adverse event is classified as unvaccinated. And who had an adverse event in the first 14 days after the second dose is classified as first dose adverse event, and so on. This is another definition of the same institute, Istituto Superiore di Sanità.
Sorry, Giovanni, can I make a parenthesis here?
Yes, please.
This, so we can explain to the public, this 14 days window is not because in immunology there is a time that you have to give to the organism to develop the antibodies after vaccination. So it is believed that you need at least 2 weeks to mount a proper, let's say, antibody and immune defense against a certain pathogen for which you have been vaccinated. And this is the, let's say, scientific assumption that allowed the Istituto Superiore di Sanità in Italy, but even other health institutes around the world to use this. For example, in the UK, this period was of 21 days, from 14 to 21 days. So this is even more, let's say, a longer period. However, we have to understand that we have to take what happens to an individual from the moment that the needle gets into the arm. We have to just count this in terms of did this person had any benefit, or did this person had not a benefit and harms. This is the main assumption that we have to think about. And someone on my Substack commented, and I use this metaphor because it is a very good metaphor, is like, for example, someone that gets bite from a snake, and we have to count that he has been bitten from the snake just when the poison starts working on his organism. So no, he has been bitten from the snake, and whatever happens after, it is a consequence of the bite. So this is the way that this should be counted, and now Giovanni will show you why during the rest of the presentation.
Okay, thank you very much, Panagis, for the precise indication of why this happened. So this is another example of the same institute, Istituto Superiore di Sanità, who defines unvaccinated cases who has been vaccinated with the first dose in the first 14 days preceding the diagnosis. So this is to define cases, okay? This is a third example in which they define how they count deceased people, so people who died, okay? Deceased individuals with documented positive test for SARS-CoV-2 who had not yet received any dose or any type of vaccine, or who had been vaccinated with the first dose in the 14 days prior to diagnosis, are classified as unvaccinated. So it doesn't matter if you are counting cases, if you are counting people who died, the same criteria has been applied by the Italian institutions. This is instead what did, as Panagis said just 1 minute before, the Office of National Statistics in England. They also defines the unvaccinated, those with no vaccination or who were vaccinated with the first dose less than 20 days ago. So they apply a 3 weeks bias, not 2 weeks like in Italy. It's even worse. These are the Italian regions who have answered to our request of public data access. So you see that in Italy we have 20 regions and only 6 regions answered and 1 province, Bolzano province. But only the data of Bolzano and Emilia-Romagna were, complete. The other data was incomplete, so they did not give us all the data we needed, like for instance, the exact date of vaccination or the exact date of death or the date of birth in order to know the age of the person and so on. So since the Bolzano province is too small, we decided that the only way to get something is to analyze data of Emilia-Romagna. Emilia-Romagna is this region in northern Italy, is a quite big region for population. It's 4.5 million people who live there. It's an industrial region. Bologna, that is the site of the oldest world university. There is the Ferrari in Modena. So it's a quite industrial important region in Italy. This is an example of the worksheet that I worked with, and I explained very briefly which data I had to analyze. The data you see here in the second column is the data of vaccination, progressive vaccination. So there is a public database in Italy where you can read region by region, in this case only Emilia-Romagna, how many people have been vaccinated in a certain date. So this was the first source of data. Every day of 2021, we knew how many people were vaccinated that day in Emilia-Romagna. This other column comes from the region Emilia-Romagna itself, and they told us how many vaccinated people died that specific day. And this is the most precious data we got from Emilia-Romagna. This third column is instead how many people died that day, regardless if they were vaccinated or unvaccinated. So by difference, subtracting the vaccinated death from the total, I got the G column, that is the next column, that is the unvaccinated deaths, okay? So this is the basis of our first elaboration. And this is the graph that comes out. Now, this has to be understood very clearly, and I will try to explain it with my best words, But if something is not clear, please ask. Okay. So the red line, the interrupted red line, okay, the rising line, is the administration of the first dose. Okay, so the dates are from February 2021 to June 2021 on the right side. And the vertical red lines marks the start of real vaccination, and the second vertical black line marks when the vaccination were almost completed. Okay, so we have in the middle the steep rise of the interrupted line, that is a cumulative line, so it tells us in every day how many people were vaccinated till that day. Okay, so this is simply the administration of the first dose in the region Emilia-Romagna. And here we are referring to the people who is 70 years old. So from 70 years old to 79 years old. So 10 years of people. The red line, the continuous red line, is the mortality rate of vaccinated people. It's very irregular at the beginning, but then it goes down, and then it's mostly horizontal. This means that while people were being vaccinated, the mortality from being very high at the beginning, it went down and then was stabilized. So this, at first sight, is a proof that vaccination works. Then the green line is the line of the mortality rate of the unvaccinated people. That is mostly horizontal before the vaccination starts, and then goes up together with the vaccination line, okay, and reach the top when the vaccinations arrive to the saturation. So here we have this situation that looked to me really strange, because this is from the month of March to the month of May, and during this period, the mortality in Italy was going down, because we were going toward the spring and then the summer, and we know that the mortality for respiratory diseases goes down when we go to the good seasons, and also in 2021, in the full period of COVID, it did the same, absolutely did the same. So this is counterintuitive, because when the all causes mortality in Italy was decreasing, the unvaccinated mortality rate was increasing. Okay, so this is completely not understandable. So we are in front of this strange phenomenon that when the vaccination starts, who is dying is the unvaccinated people, with mostly the same rate, because Marco Alessandria and the others that, as I told you, have performed the most sophisticated statistical analysis, were able to produce this correlation graph that in horizontal has the number of administration, so the number of people who were vaccinated, okay? And vertically, you have the incidence rate, so the mortality rate in the unvaccinated group. So there is a strong correlation, as you see, between the vaccinated people, the doses that were administered, and the mortality rate in the unvaccinated group. Okay, so I show you again the graph where you see the visually, here you see just visually the correlation between the vaccination and the mortality that increases in the unvaccinated group. If we go to the other age groups, this is 60-69 aged people, we see that also here is very clear that in the exact moment that they start to administer the doses of the vaccine, the mortality of the 60-69 age group rises up and reach the top when the vaccination is saturated. This is for 50-59 years old people. And here we see more or less the same, okay? The interrupted red line, that is the vaccination, goes up, and the unvaccinated people starts dying, okay? And I repeat, here we are a bit later because the 50-59 were vaccinated some months later than the 60s or the 70s years old people. But also here we are going from May to June. So in a season in which the mortality rate, all causes mortality rate was going down, okay, in Italy, but the unvaccinated people apparently and it's very strange, was dying less when the COVID mortality was higher and was dying more when the COVID mortality was lower. Okay, this is completely against any logic. This is what Professor Norman Fenton has studied even before in 2021. So while the phenomenon was happening, immediately recognized from the UK data that you see the blue line is the vaccinated mortality, the orange line is the unvaccinated mortality, and the gray line is the uptake dose, so is the administered doses. Okay, so also in this case, also in the UK, the same phenomenon occurred. They started vaccinating a specific group, in this case 60-69 years old people, and the unvaccinated started dying exactly in correspondence with the rise of the vaccination curve. This is an article of 2024 in which Professor Fenton is commenting what happened, and so you can read it on his Substack. That is very, very well done. I invite you to read the Substack of Professor Norman Fenton. This is another graph that our group elaborated about the UK data, okay? And we also have see in the UK data ourselves the same exact phenomenon. In this case, it's a bit different because the structure of the English data is different. So you see horizontally the RR, so the risk factor of the unvaccinated people as 1, okay? And you see instead, this is just as a reference, and you see the red line, that is the mortality rate of the first dose in correspondence with the second dose rollout. So this is different, but this is coherent with the definitions I gave you before. So who's the first dose vaccinated person? We define the Institute Superior of Health in Italy and the ONS in UK, they defined as first dose vaccinated person who received the second dose in the first 21 days. Okay, so also in this case, we see that when the second dose goes up as number of doses administered, the first dose people starts dying. Okay, so also here we see the exact same phenomenon. This is the same graph, but for non-COVID deaths. So we tried to isolate the non-COVID deaths to show that this is not due by COVID. These are simply all causes deaths in exact correspondence with the administration of the first of the second dose, and the first dose that people start dying for non-COVID reasons.
One question, Giovanni, if I understood,
Yes.
just to check that I understand well, those last two graphs shows us that the people who are first dose vaccinated but receiving or not the second dose are dying more during the second row of vaccination, of the second dose row of vaccination. But we have the green baseline, which is supposed to be the people who didn't receive anything during the first period.
Yes.
All right. And so this baseline is not moving at all. So
yes, it's not moving at all because it's taken as reference, as supposed assumed constant. Okay. And you see in red, instead, referring to the one, the increased risk of dying by the first dose people.
Okay, I understand. So it's comparative, it's a relative risk comparatively to the unvaccinated. But if we had the raw data of the unvaccinated, would we have something like a flat line, or would we have also like a uprising, but less fast, but rising a little bit in the unvaccinated, the label unvaccinated, because maybe the people who are labeled unvaccinated have received kind of a first dose during this second row of administration, and is it understandable what I'm saying, or?
Yes, but the problem is that UK data has not the same structure of the Italian data. The Italian data is are very clear, and they are day by day data. We have data day by day, and we know exactly how many vaccinated people died that day and how many unvaccinated people died that day. So we can do an exact day by day comparison. With the UK data, we cannot, because the ONS has pre-elaborated the data, and they have presented that not daily, and also not in a way that we can compare them directly. So this has been the only way we have been able to do the comparison. We are not able to make a direct, more clear comparison as we could do in Italy for region Emilia-Romagna. So we had to present it in this different way. But anyway, the important thing to understand is that when you administer the second dose, who dies is the people who have not received the second, who should have not received the second dose. So the first dose people, okay? And this is the paradox, okay? So this is just to show that also in the UK, we show the same paradox.
Okay. And is this data been commented by the English authorities? Did they say that they were not protected against the epidemics, and the epidemics were killing them, or anybody raises them and said, "Oh, did they receive the second dose but are not counted yet as a second dose?"
No, the UK authorities denied that this happens. Denied that this happens because they told that, yes, the definition is that one, but it's only to establish the efficacy of the product, not to count them statistically, okay? So they said practically that they didn't use this criterion when calculating the data that they published on their website about mortality of the different categories, unvaccinated, first dose, second dose, etc., etc. This graph proves the contrary. So proves that they did use that criteria. Okay, so this is the point, but they are still denying that they did not use, that they didn't, they're still denying that they applied this bias. This is the point. And also in Italy is the same. Nobody in Italy admitted that they counted that way. They simply defined the categories that way, but they pretend that all the data that have been published is actual. I mean, with the data of vaccination that corresponds really to the day that the needle entered the arm. But with our graphs and our subsequent statistical analysis, we prove that this is not true. So we prove that the bias has been really applied.
Yes, and sorry. I mean, the main thing that this graph shows for the UK data is that the same case counting Windows bias applies even for the first, the second, the third dose. So each time you see again this trend with the people that had -1 dose, and we have to say that the Office of National Statistics stopped releasing this data, I think after spring 2024, because this effect was, let's say, evident, and people were starting making this kind of analysis. So probably for this reason, they stopped releasing and making public this data. Until then, the UK was the only, I think, country in the world releasing the mortality rate, let's say, by vaccination status. And after the spring of 2024, they stopped probably exactly for this reason.
I think it's 2023. They stopped.
23, sorry.
Yeah. Okay, so I also want to add some other calculations I have done after our study was published, because I was asked to estimate how many deaths were not correctly classified, and the final calculations, and also a comment, a very good comment about the article, was published on this Italian nationwide newspaper, La Verità. Is not an online newspaper, is a normal paper printed newspaper all over Italy, and they published this article with the subsequent calculations we tried to do. This is in Italian, but I will explain it very simply. For the 79 years old, the region Emilia-Romagna declared that 1,434 people died as non-vaccinated. I estimated that actually 531 of those was actually vaccinated, but in the window of the first 14 days. Okay. And this is the 37% of them. So it's a big percentage. For who had 69, for who was 69 years old, region Emilia-Romagna declared that 467 people died as non-vaccinated. Actually, I estimated that 106 of them was actually vaccinated, but in the first 14 days. And for 59, 222 were declared as non-vaccinated, and 93 is my estimation. How did my estimation? Well, I presumed that the unvaccinated mortality rate of the month before the vaccination started was constant also in the months after. This is a by defect estimation. I mean, we know that the mortality was decreasing during those months because we were going towards spring and then summer, okay? But to be safe, to be sure, I thought, okay, let's think that mortality rate doesn't go down, that is constant. Okay, so I estimated all the deaths that were over the previous month. And in this case, this is an underestimation of how many people have been misclassified because of this bias. So I'm sure that they were not, in the first case, 70, 79, they are not 531, they are more. But I'm pretty sure that they were at least 531, so that at least the 37% was misclassified. And in the case of the other categories, more than the 23% or more than the 42% in the case of the 50, 59 years old. So this is the estimation. This is a table that shows it maybe more clearly. I did it also for the over 80 years old people. The people who was declared as non-vaccinated deaths were 4,368 by the region Emilia-Romagna. What we that should be the number of deaths because of the previous months, it was 2,653. So the difference is 1,715. This is my estimation of the classification bias. So almost 2,000 people in the age of more than 80 has been misclassified during that period. And in this case is a very high percentage, the 64%. So as you can see, it's not a light bias, it's a huge bias that literally can reverse the estimation of the effectiveness or of the treatment of the vaccine in this case. Okay, so this was my last slide, and we can stop sharing. And if there are any questions, or if Panagis, I'm sure Panagis want to add more and show his slides.
No, yes, I wanted to focus on your slide of the article La Verità.
Okay.
Because as you said before correctly, this gives the idea that this kind of bias is not a small bias. It has the potential to completely reverse the results. And Professor Norman Fenton made a very nice tool to prove this effect with a vaccine that has even a negative effectiveness, and it shows, this tool shows, anybody can go and use this tool, and shows that even a vaccine that has a negative effectiveness gives the, let's say, the wrong perception that it has a positive effectiveness in the first period of time, due exactly to this bias. Exactly because, as we can see here, there is a huge percentage of people that gets moved in the unvaccinated group. We talk about 37% in the age group of 70, 79. 23% in the age group 60, 69, and 42% in the age group 50, 59. So this gives the idea of how much this bias can distort the results. And that's why it is fundamental for people around the world, in each country in the world, to get motivated by this study, that is the first study that proves this case counting window bias distortion in the peer-reviewed literature, to get involved and get actively asking the mortality rate by vaccination status to the health authorities in order to be able to do studies like this. Because if you don't know the mortality by vaccination status, then you are not able to get these results. And I was very happy to receive some requests from different people from other countries. For example, we have received a request from Norway after they read this study, and there is a group of researchers that wants to do the same. So they asked us information on how to write a proper FOIA request and to analyze the data, just because they did not receive the data from their administrations. And we have to understand that it is our right as citizens that pay taxes and that live in a country to ask this data for our authorities. And it is very suspect the fact that our authorities deny to give us this data that should be publicly available to everyone. So I really prompt all people around the world that are interested in trying to understand the truth and how this kind of biases distorted the real effectiveness of the vaccines to do the same we did and try to reproduce this study.
Thank you, Panagis. I have to add that in France, too, our colleagues, Laurent Toubiana from INSERM and Pierre Chaillot from Statistical Institute, they asked, oh, excuse me.
They asked for the data.
They asked for the data, and the authorities answers this data doesn't exist. But they published with the group EPIFA, they published the results, so they have the data, but they say it doesn't exist. I have something concerning the biological aspect of this exclusion of 14 days or 21 days. They say the justification is the 14 days are needed to express a full immune response. But we have to add that antibodies are produced from day one, but they are not in a large quantities, and they are not very specific. They are not very useful. I have to add that cellular immunity has not been tested in clinical trials, so we don't know when is the cellular immunity correct. So we are only interested in the supposed beneficial effects, and we reject a priori the harmful effects due to incomplete immunity. But it is important to highlight the paradox. What is the best way to evaluate the immune response to a vaccine? It's to measure its effectiveness against the disease and not the antibody level. Therefore, effectiveness should be evaluated from day one. So the vaccine starts working from the first day of injections, because antibodies start to be produced from the first day. So it's clearly fraudulent to classify those who have been vaccinated for less than 14 days as unvaccinated. It's a fraud for me. It masks the facilitating effect of infection caused by vaccine, as well as early adverse effects, including death. And it's the same way for the flu vaccine. They also exclude the first 14 days after the injection to assess the effectiveness of the flu vaccine. And more about concerning the booster, the exclusion of 14 days after a booster shot is even more and justifiable because the booster immediately reactivates the memory cells. So antibody levels and cellular immunity increase immediately after injection. It's clearly fraudulent. I think we can use this word fraud. Well,
I totally agree. It's a fraud. It's a totally fraud, because one thing is to assess the effectiveness. I'm not a doctor, so I don't want to say more words about it. But when you assess the safety of the product, it starts from the exact moment you receive the needle into your arm. Because if you have an anaphylactic reaction, is that not the vaccine? Of course it is. We have literature that states that, okay? So we have to count it. We cannot say, oh, 14 days have not passed, so the anaphylactic reaction has to be counted as an unvaccinated people. This doesn't make sense. So it's of course a fraud. It's of course a total fraud. But the institution have been, happy to apply this rule, this classification bias, because it allowed that to count all the adverse events of the first 2 weeks or 3 weeks in the previous category. And this has been given to the public as statistics. And so this has an impact also of with the informed consensus, because people were not informed correctly at all by the media, and not even by the doctors at the vaccination hub or by any other medical doctor, because anyone who was reading the official statistics was reading false statistics affected by this bias. And so not even the professionals were able to have the correct informations, not even them. We didn't know. Professor Fenton in England was the first one who think and prove mathematically, because he's a mathematician, what can happen even to a negative effective vaccine, that can be, the negative effectiveness can be masked and reversed by this bias. So even if it's negative effectiveness. So, the word fraud for me is completely appropriate in this case. And I want to add something about the difficulties in getting the data. The lawyer who collaborates with us and asked to all the Italian regions this data, it asked to the regions because it was a big problem. It had a big problem with the state. So why you should ask to every 20 regions in Italy when you can just make one single request to the Italian states? Of course he did. He sent a request of all the vaccinated people mortality to the Ministry of Health. The Ministry of Health answered in 2022 that they had not the data. Can you think about that? They had not the data. How that can happen, the data of the data? They have the National Archive of who's vaccinated and who's not, and you have the official database of who died and who's still alive. So you have just to put together these two tables. It's not difficult at all, not difficult at all. But they told the lawyer who made the request, no, we have not the data. Maybe the National Superior Institute of Health have the data. So the lawyer made a second FOIA, a second public request of access to the ISS Institute. They told the same, no, we have not this data. Maybe IFA, that is like EMA, okay, the medicine approval agency, maybe they have the data. Okay, so he made a third request to IFA. No, we have not the data. We are sorry. Maybe ISTAT. ISTAT is the Italian Institute of Statistics. Okay, they have the data. So he made a fourth request to ISTAT, and ISTAT told, no, we have never had this data. Maybe you can ask to the Ministry of Health. So he went in a loop, in a full circle. So he asked again to the Minister of Health, you must have the data. The Minister of Health didn't answer this time, didn't answer at all. And he had to answer by law. So our lawyer started the trial to the Italian administrative tribunal. After a few months, now we were already in 2023 or 2024, I don't remember, the tribunal condemned the Minister of Health to produce the data, because the sentence said the Minister of Health has the data. They have just to put them together, okay? So the tribunal said this and condemned the Minister of Health to pay the expenses of the trial. So they lost on all the line. And after this, the Italian Ministry of Health produced the data of the vaccinated dates of death of all Italy and sent the database to our lawyer. I started to analyze the data. I was happy that day. Oh, finally, I have the full data of all the vaccinated people who died in Italy day by day. I was really happy that day. I will know the truth. It could be also contrary to my beliefs, but to my hopes, it could be also a different result. Okay, but I was happy. I started to analyze the graph, and I saw that the graph was not regular. The graphs of how many vaccinated people were dying that day, the graph was regular for the first month, and then, boom, had a vertical step on the 1st of October, and where the number of vaccinated people who died daily was passing from 250 to 850 in a single day, okay, and then proceeded rising up. Of course, the data was not usable at all because it was affected by elaboration mistakes, biases, negligence. I don't know why, but I just suppose that till October 2021, they registered a few regions of Italy, and in a single day, they added other regions, okay, for 3-4 months. The 31st of December, boom, down. So they stopped counting other regions and they continued on the previous trend. So the data were completely unusable. So what we did, we sent a letter to the Italian Ministry of Health with the printed graphs and some comments telling, this is what we got from your data. There are clearly some faults, there are clearly some mistakes in the data. What do we have to comment? And we got a letter in answer, and the Ministry of Health told us, no, the data are okay. Every week, we made a meeting call with all the Italian regions, controlling the numbers, controlling every calculation we made. So we are totally sure that everything is okay. And they told this after seeing the graph that I just described to you. So we couldn't go anywhere with the Italian Ministry of Health. So our lawyer started to ask to every one of the 20 regions the data, and only 6 answered, but 4 with incomplete data, 5, sorry, with incomplete data, only the province of Bolzano and region Emilia-Romagna. And so you see how difficult, really difficult, has been elaborating this data, that I think, personally, I honestly think that the Ministry of Health should have been released by itself, telling people, okay, this is the data of the worst epidemic of pandemic events in our history. Please do an independent evaluation. This would have been honest. In the UK, they have been more transparent for the first years because they have published data. They were not raw data. like we were hoping to have. They were already elaborated data, so it was much more difficult to get something by them, but actually they at least published the data till 2023. Then they stopped publishing the data because they also published the comment why they stopped publishing the data, because the data were wrongly evaluated by the independent researchers. Okay, so since the independent researchers were making mistakes in understanding, in reading the data, they stopped publishing the data. I mean, I will stop commenting here.
I will add something. In 2021, I showed that this effect and manipulation can be seen in Pfizer's trials. Louis, I give you the link to my article in AIMSIB blog. They artificially increase the number of COVID cases in the placebo group 15 days after injections, so that the placebo appears to be effective. Also, most effective like the vaccine. But after this period, this critical period of I think 1 month after the injections, they stop to manipulating the data. So you see the difference between the critical period and after the critical period. It seems that placebo, the saline water, is as effective than the vaccine. I saw it in the Pfizer essay. I wrote it, I told it, but nobody understood what I was meaning. But it's the same, in the same manipulation.
Maybe they understood it, but they didn't want to acknowledge it. And well, I want to say about the fact that the only adverse reaction that has been recognized in the vaccinated was the anaphylactic shock, just because many times people got the anaphylactic shock before going out from the vaccination center. Many times they died before exiting the door of the vaccination center, so they could not deny this effect. So basically, and you, Helen, you know about the underreporting of the adverse reactions by the medical doctors, that it is estimated to be like 1,000 times less than reality. So all the other adverse events that happened in the 2 weeks period or 3 weeks period, if you were in England, were misattributed to the unvaccinated group, and this had this double effect. They increased the mortality of the unvaccinated, and they decreased the mortality and the adverse reaction rate in the vaccinated group. So yes, it is basically a cheap trick, like Norman Fenton called it, and a fraud, like you defined it before correctly.
I would like to emphasize one point. First, thank you for this harsh journey across the institution of Italy to get the data. It's very impressive, all what you did with your lawyer, and we understand now that if we want to make research on the national statistics, we have to have a lawyer with us, which is a strange thing. Normally, you don't need that. But you did it patiently, methodically, and then you managed to get the data of the province and the regions. And it's very important to be multiplied so that everywhere, just like Panagis said, people try to find back the truth and not stay in the blurry falsification of this misleading classification bias. We understood from the very beginning that this 15 days or 21 days were like a thumb rule, who's vaccinated and not, and it had nothing to do with biology or anything. And one important point. I can draw a parallel with what we do in randomized controlled trial, where we test a treatment. For the group who receive the treatment, we are in intention to treat. What does it mean? It means that even if they don't get the treatment, they are counted in the intention to treat group, so that we are pessimistic, meaning if ever there would be a good effect and they didn't take it, we wouldn't see it, and it would be part of the intention to treat group of the treatment, and not the contrary. We would not put them in the placebo group. So this is not about timing, but this is about who received and who received not who didn't receive the treatment. So it is not the use to be optimistic in presenting the data, and that's what Giovanni showed you when he stated what would be the normal death ratio. It took the highest one and didn't consider it would go down during the period. It was pessimistic for his own hypothesis, and that's the normal use in science and research.
Right.
Okay. So this is really an important work that you get there. Norma Fenton began, and then you are continuing, and we hope that we're going to manage to get the data and do that in France also, in some regions. We're going to follow your advice. As Hélène told you, two researchers tried to get the data, but this the FOIA that we have in France is called CADA, and CADA is misleading all the time. Trying the data that don't exist, as they told you with the Ministry of Health, they told us the same thing. So we have to be more aggressive or patient and try to find it somewhere.
You have to be very stubborn. This is the word, because there is a difficult to get the data. It is the first very big step. And then the second very big step is to be able to publish the data. Because, for example, Norman Fenton and Martin Neal, they have a paper that is still in preprint from January 2022. So I just can imagine how many times they tried to submit the paper and to try to publish it, and they didn't. We, for example, in our case, we tried like 4 or 5 times to publish it, and everybody was rejecting it. And the paper that Dr. Banoun was referring to before, and I really thank her for her very good and remarkable review. It got submitted in 2 years. It got submitted 16 times. It got rejected 16 times, and I will publish a commentary on that that explains all the mad and paradoxal story of this study. And I wasn't trying to publish it on Nature or on the New England Journal of Medicine. I was trying to publish it in some very minor journals with very low impact factor, like 1 or like 0.5, and I couldn't publish it. So there is a very big battle that the scientists, the unbiased scientists have to do to get published their data in order to show the truth to the world and to the scientific community. And so yes, be prepared to have a lot of patience, a lot of strength, and you have to be very stubborn in continuing, just giving your battle for the scientific truth.
I must add that for the article Panagis referred to, it's another article. The last review who refused it, first they accepted, then they refused, then they again accepted and then refused. And we see the influence of the big pharma of industry in that refuse and accept. I think it's the influence, it's a direct influence. Or perhaps they are afraid from big pharma, but I think it's a direct influence of the industry.
Yeah, and we can
Yes,
feel
it
that
is,
there is an inner war in the editorial board. Some want to accept it, and some refuse it because they are
no,
paid. No.
In that case, it was a war from the publisher. So the reviewers accepted the paper. It passed four rounds of review. The reviewers accepted the paper. The editor accepted the paper. So the paper went in production. I was waiting for the proofs. After a few days, it should get published. And the publisher, who is a non-scientist, get in the middle, and he blocked the publication of the paper. And this happened twice. 2 times the same story. Because in the first round, I said that I would have exposed all this story, so they decided to accept it again. So they made another round of revision, so a 5th round of revision, and they accepted the paper. And then again, it happened the same, and they rejected the paper for the second time.
Not only Panagis, we have also to add that the English
This not for the. We were not talking about the Emilia-Romagna study. We were talking about another study on the potential mechanisms of cancerogenicity of the COVID vaccines.
Okay.
And right. But yes, even this one had a very complicated story to get published, and this clearly shows how there is an attempt from the higher ranks, let's say, of the editorial scientific world to hamper the publication of this data that exposes the truth. So in my case, I saw that the only way to come out from this is to be stubborn and keep doing again the same thing, submitting, trying to release the truth. And this is why, for example, even some platforms like Substack got so popular, because now many scientists, like, for example, Norman Fenton, Martin Neal, Jessica Rose, McKenna, many scientists are publishing their studies there, because mainly they cannot have access to the scientific publication. The problem is that whenever you go with a Substack paper to an authority, they say it's not a scientific paper, it has not been peer-reviewed, so for me is nothing. So, and I say this because we have to try to keep trying to publish our data in the peer-reviewed journals, because they are recognized by the authorities. You can go with a peer-reviewed study to a public authority and show your results. So we have to make this sacrifice, and we have to keep making this fight in trying to release our data in indexed peer-reviewed journals.
Thank you, Panagis. This is a very important point that you raised, and we discussed it in Brussels, where you underlined and stressed the fact that this was really an important point, and the audience should, and also the doctors and scientists should understand that there's a real problem of epistemology there, because what is going to be the truth is completely under control. And so we have to stand in the battlefield and not submit and surrender, because all the system is dependent on the published data in the scientific edition world. And you're right, PubPeer is existing, Substack is existing, preprint exists also, and so there's a lot of way to try and make the people warned about what's going on really. But in the end, you're blocked when you are dealing with a lawyer or with an institutional administration where they don't want to consider the information if it's not stamped by the authorities of the scientific edition world.
Yes, exactly.
Okay, thank you very much. I invite all our audience to go and read the article, upload it, show to the edition board that it's an important article and that they were right to publish it and not to be afraid of publishing it. Translate it in your own language, try and draw the graph and explain to your neighbors, do whatever you can to give the information around you. And if any of the people listening to us are part of a National Statistic Institute anywhere and they want to give us any data, please be welcome. It will spare the FOIA process. So if there are whistleblowers, be brave and do what you have to do. Do you have any other comment, Hélène or Giovanni or Panagis, about the study and something you want to add before we conclude?
Just thank you for your courage to publish this data.
Thank you.
You're welcome. For us, it has been a big satisfaction. I mean, but I want to underline that the merit has been given to Panagis, because actually he was the lion of the publication. He was the one who submitted many times, and that he fight with the reviewers and then with the publisher, and then he had to threaten to menace them. Oh, I will reveal everything to the media if you do this to us, etc., etc. So he was very determined and even aggressive in order to get the paper published. Otherwise, they would simply say no, but if, and they keep gaining time and delaying. And I want to underline that the graphs of the UK that I showed you, the one with the green line, etc., they show the phantom paradox elaborated by us. They were in the article, they were in an appendix, because the article is on the Italian region Emilia-Romagna. Okay, but we wanted to show that also in the UK, we had replicated the same phenomenon, okay? But you have to think that Taylor and Francis is English, and they probably didn't want to have the English data and the ONS trick revealed so clearly in their publications. So they didn't allow us to publish the appendix. The appendix was cut off. So I showed you those graphs, but they are not published. Only the Italian graphs are published, not the UK ones.
Are they on a preprint server? This appendix data? No,
we decided when they did not accept the annex of the UK data, we decided to divide them and use them to make a brand new paper just on the UK data.
Yeah.
But if we decided to upload it in a preprint server, I will inform you.
Okay.
Okay, thank you very much, Giovanni and Panagis and Hélène. Thank you all to have listened to us, and don't forget to share, put the thumb up under the video, and make a commentary, all what you know how to do on the social media, so that it's seen everywhere. It's surprising somewhere that it's 5 years after what's happening, that the truth is beginning to unveil, and it's a slow process. So we have to be patient, but it's going to come.
Let's hope.
Thank you for having us with you.
Yes.
Thank you.
It has been an honor and a pleasure to be your guests.
For us too.
Keep fighting in France.